As the number of cases and deaths of the coronavirus continues to rise, so does the concern of the racism and xenophobia faced by East Asian communities all around the world, including here in Canada. In fact, Canada's Chief Public Health Officer, Dr. Theresa Tam, tweeted, quote, "I am concerned about the growing number of reports of racism and stigmatizing comments on social media directed to people of Chinese and Asian descent related to 2019 NCOV. During today's episode of Living in Color, we'll discuss the coronavirus, the misinformation being spread, best practices to keep safe, and how all this is affecting the East Asian community." Today I'm joined by Dr. Joseph Wong, a family physician who is also the founder and chair of Yi Hong Community Wellness Foundation, as well as Kennes Lin. She's the co-chair of the Chinese Canadian National Council, the Toronto chapter. Welcome to you both.
Thank you.
Let's start with facts over fear. And I'm going to start with you, Dr. Wong. Does the virus discriminate?
No. The virus, this coronavirus that we know of now, is actually a family of viruses that attack human beings after they mutate. So 17 years ago, it mutated and turned into SARS. And a few years ago, it mutated and turned into the Mideast Respiratory Syndrome. And this new one virus is, we call it the new pneumonia viruses from Wuhan. So these viruses have been in wildlife for thousands of years. In that particular place, the people there actually bear the brunt of the battle against the virus. So instead of discriminating people from Wuhan, I think that we should sympathize with them because they bear the brunt. They are now in lockdown, and they bear the brunt of, so much inconvenience and economic impact is huge, social impact is huge. I think that we should help them fight the virus so that we could contain the virus without the virus spreading to other places.
You're saying instead of seeing it as a threat, see this as a kind of a human tragedy in a sense,
Yes.
right? To see
Yes.
that they're going through this. But let me turn it over to this, because I think there are people who think, 99% of the cases, Kennes, they've come from China, and that's why there is this fear. What do you say to that?
And I think that for the fact that of the health risk in itself, that is legitimate fear. If it is coming and there is a risk of death and risk of spreading, the health that is legitimate. What is not legitimate is the stigmatization, is the fear mongering, is the fear that of who are these people and the link of the racialization of the virus in itself.
So just because they're Chinese, it doesn't mean that they have this virus.
I think we have to put things in proper perspective. 99% of the cases are confined to the borders of China.
Right.
So we in North America and other places only bear 1% of the cases. And that means whatever China has been doing seems to be effective in controlling, in confining the virus inside its borders, but this is really, the chance of contacting them is so low that I think that our actions or reaction probably is a little bit overblown.
But then let's look at the world reaction, because there are countries like Singapore. Singapore has a huge Chinese population that's banning people from China from entering their country. I mean, we're seeing countries doing this. What do you make of that reaction? I'll start with you, Kennes, about that.
A lot of research has shown that border control has not been the sound health policy to reacting to and responding to global health outbreaks. And when that does happen with border control, what actually happens is further stigmatization and blaming and creating more of a moral panic of what this illness and what this virus and the outbreak can be.
Dr. Wong, though, this is a country that's thinking it's protecting itself. What do you make of these?
I think proper protection is very important. But even without the coronavirus, we have to do the same thing. Say, for example, I think that it is very important for us to protect ourselves against influenza in Canada in the winter, because influenza kills a lot more people than any other viruses in Canada.
Right.
And in Canada, I think that all of us should practice good personal hygiene with or without coronavirus. So washing your hands and don't touch the handle. If you touch the handle, wash your hand again. And it's very important, hand sanitization. And wearing a mask, is it very important? research hasn't shown that it is very effective. It might be minimally effective, but it is very important for those who have the symptoms, who cough and who sneeze and who have fever. They should cover themselves with masks.
Why are we seeing a lot of people wearing the mask then? So you're saying if you're containing your symptoms, it's a good idea, and that's what health professionals, but public health has been very clear that if you're afraid of getting this, this virus, you don't need that mask, Kennes. But we're seeing people out there on the streets right now who are wearing it. Why?
That's a really, really good question. I think that really goes into the cultural aspect of mask wearing as well, and as well as the different public health policies and approaches. As you see the messages that are coming from Hong Kong and China, a lot of the public health messages have been asking people to wear masks to keep what, like you had mentioned, to themselves. But in turn, in Canada, that message has been quite the opposite. And so what we see actually as we go into the northern parts of Toronto and Markham and Scarborough is still this mask wearing. I think that really speaks also to whether or not there are language resources within Canada that has been spreading the public health messages to the population, because a lot of the Chinese populations within Toronto, within Scarborough and Markham have been getting a lot of their education from messages through social media from back home, from Hong Kong, from China.
When I was in Hong Kong in the 1960s, 70s, I really have not seen people wearing masks. Very, very infrequent. Only after the SARS in 2003, people started to wear masks. And after that, people wear masks just as a matter of factly. It is, you really don't need to have a virus going around to wear a mask. And particularly pollution in Hong Kong, pollution in Shanghai and Beijing, it is pretty severe. So people wearing masks both because they wanted to prevent viruses or other infectious diseases, but on the other hand, wearing a mask, they thought that they could prevent pollution from getting into their lungs. So they started to wear masks only less than 20 years ago, and it is quite accepted now.
That is so interesting that you mentioned SARS, because you know, I think the other thing about SARS was this trauma that people went through during SARS, right? Like, talk to me about that trauma, about what that was like to you know, deal with it as a medical professional, but also as a Chinese Canadian. What was that like during SARS?
And aside to the health and to the deaths that came from SARS itself, was also this devastating social, psychosocial, as well as economic impact to the Chinese Canadian community. What that looked like was that in the different Chinatowns within Toronto, Greater Toronto area, we looked at 40 to 80% financial losses with the small businesses to the restaurants that had led to a much longer lasting impact even after the virus itself.
Yeah, I mean, businesses closed down because of SARS in some parts. There's a restaurant, you know, that everybody's embraced recently in Toronto that's called Wuhan. It's a noodle bar in Markham, and we've seen a little bit of a difference this time. Do you sense that it's the same, or we've evolved since then and learned things from SARS?
I think we learn a lot, and I think that we should be a lot better prepared this time. But the social media really increased the stigmatization.
The misinformation.
The misinformation, because people don't know about it, fear of the unknown. They speculated it, they just talk about it. It is not based on facts and figures. It is not based on proper understanding of this new coronavirus that has been rampant, okay, in China, but very few in Canada.
Did it surprise you, though? I mean, when you looked online, and I'm sure you've seen some posts that are pretty racist, did it surprise you that that exists or no?
No, I think that in every society there are certainly very subtle racism. In Canada, we pride ourselves as
Being
the
diverse,
country,
right?
The country with multiculturalism, very diverse population. We still see a lot of racism in our own community and our own society. So I believe that more education is needed, and I think that we should just tackle it head on instead of letting it hide underneath.
I think what's even more dangerous and powerful about social media at times like this is that with a lot of already misinformation is the amplification of it. And the ease of pressing a button, of liking, of making a statement where your face is not shown, where your names could not even be your real names. And so with the ease of that, as we talk so much often about the power of social media is also the danger where currently with the coronavirus outbreak, it's created almost this platform for racism to be more even overt, where a lot of these thoughts for many individuals already have in their minds, but have constantly been more covert kind of racism. In the wake of and the ease of social media has become very overt. While there is clearly all the facts to support that the virus can mutate anywhere, still has been called the Wuhan virus. It has been called the Chinese virus. And that in itself has completely been placing the blame on Chinese and all around the world as well. We see these, the hashtag Je ne suis pas un virus in France, and I am not a virus in France. And so Chinese communities all across the world with places where coronavirus has showed up has now taken also the brunt of it too.
I mean, but even like when you think about other fundraisers for Wuhan right now, or people raising money to help them, is that happening right now?
There is something happening, but I think that a lot more are happening because finally we understand what it is and how we are going to control it. So if we could help the people in Wuhan, the people in China to fight this virus, the safer we are. Okay, both for us
it's
and
in our
them.
best interest too.
Yes, it is
Right.
for our best interest, for a lot of protective gears to go to China so that they could protect themselves. The frontline medical people, they bear the brunt, they really do, right? And if they are willing to take care of the sick and those people who are infectious, they should have all the protective gear that they deserve.
Let's bring it back home here. How do you think our governments, our school boards, officials, civil society, how do you think that we should be educating the public more, and what can we be doing better to help the Chinese community through this time?
One of the things that we learned very well after the SARS epidemic in 2003, through the various research and reports that came out from that, was the fact that public health policies or public health material was distributed mostly in English and French, where a lot of the information hadn't gone to different communities that wouldn't have understood or as fluent in those two major languages.
Right.
So one of the first things to begin with is, first of all, the material that needs to be created that can be distributed to the community and meet them where they're at in that level. From an education and an education system standpoint, first of all, it's been thumbs up to the York Region District School Board to have stood up against the petition with over thousands of signatures that had specifically asked students to stay home, Chinese students to stay home who had visited Wuhan, and to have with such a very strong racial undertone to that. So first of all, standing up to very racist petitions that are signed. Also, but what I also think about is the psychosocial impact that it leads to students and youth and children as they go into the schoolyard, despite this petition being completely shot down. As these conversations around the dining table, when parents who are those who did sign the petition bring those conversations and values to their child, and those children bringing to the schoolyard and seeing a Chinese student or a Chinese youth, then those interactions, I think about the bullying that could happen on the schoolyard. And so from an educator standpoint, it's especially important then to not only tackle and have convey very clear messages about the virus and its spread, but also this ongoing work with anti-racism in the school system.
So the virus actually has not created a lot of health impact in Canada, but it has created a lot of psychosocial problem in our communities, whether it be in schoolyards or in restaurants or elsewhere, in the public places, in transit and things like that. We have heard a lot of horror stories. But on the other hand, I think the public health authorities in Canada have done a good job, but they haven't done enough. I think that they should, together with the Ministry of Education, Ministry of Health, have to go down to schools and to school boards proactively to talk to the teachers, because teachers are seen as authorities by the students, by the young people. So if they have misinformation about the viruses, they themselves could be spreading wrong information and wrong attitude, how we treat our fellow students, how we treat Asian-looking students, not only Chinese, They could be Japanese, they could be Korean, they could be other Asians. Okay, so how, if there is such a problem, I understand the fear, I understand the hang-up of people, but how do you treat them? How do you guide them?
Right.
I think that the teachers need to be educated very well.
This has been a really insightful conversation and a very timely one. So thank you both for your time. Dr. Joseph Wong, Kennes, thank you so much for coming in. And thank you for watching Living in Color. Thank you for watching Living in Color. If you enjoyed the show, please subscribe to our YouTube channel. And if you have an idea for a future Living in Color episode, we'd love to hear your thoughts. Please leave them in the comment section.